Hi, how are you? Good.
We are back here at the Profitable Dentist Conference, the Dental Practice Owner Conference in Orlando, Florida. And I'm your host, John Stamper of the Digital Trade Show podcast. Very, very excited. To my guest to the left, I guess if you're looking on the camera, it's to my right. I don't know how that works. Saturday morning. Elijah Desmond is the owner of a lot of things, but this morning he is going to talk about driven dental marketing. Good morning.
Good morning.
How are you doing?
I'm doing good. It's been a fun conference. There's a lot of distractions happening in this conference right now because there's a lot of people walking by.
Exactly.
But it's been a really good conference so far. It was
Yeah.
fun yesterday. We got to meet Jamie and I and Dr. Bill got to see some amazing speakers, and I mean we got front row seats because we were hosting it.
Yep.
So it's been good.
Yeah, it's kind of neat. I mean, I know certainly with some of the events that you've had, kind of kicking this thing off and changing the world of continuing education and how people are learning about companies and CE. It's exciting times.
Absolutely.
Yeah.
Absolutely.
So yesterday you had the opportunity to kind of be up on stage. Now we're going to turn a little bit around on you and have you talk about driven dental marketing and the early success that you guys are having and how you're helping dental practices with what you're doing.
Yes, absolutely. I think before we even talk about exactly what we're doing, I'm just going to say one word, and it's wait list. Anytime that you have a wait list, then you're doing something right.
Absolutely.
We've been on a wait list since January, and it's been amazing. Yeah. And I'll tell you what, I know we probably want to get into exactly what it is that I'm doing with driven dental implant marketing.
Yeah.
But I think it's important to understand that in business, in any business that you have, a lot of people spend their entire career perfecting a product. And I'll tell you what, our product is perfect, but perfecting a product or building a product or a service and scaling a service are two entirely different things. And so, our product is perfect. The scaling of the product is what we're going through, and that's why we're on a wait list. And so, basically, we want to continue to offer a very high value to our dental offices and our dentists. And it's like, how do I explain this? If you take too much on at once, you're not going to be able to deliver that. So that's why we put ourselves in a wait list situation.
Sure.
But so basically exactly what we're doing is we're very niche for marketing, and it's dental implants only. So we are the best at dental implant marketing. And so it's super important to understand there's a lot of marketing companies out there, and they all do some amazing things, but it's difficult to be like really, really good at everything.
Right.
So we're really, really good at one thing, and it's high-value dentistry. So that means that you work, less, not more, and yet you make a lot more money, and you change a whole bunch more lives. So we're specializing in essentially bringing in those high-dollar patients that are spending a minimum of $5,000 to $50,000 plus.
Yeah. Can you talk a little bit about? I think what's fascinating, Elijah, is the story of how you. I guess how you came to understand and learn that this would work.
Yeah.
And the success of the niche, certainly of the implant side, and kind of how you got to that.
Yes, absolutely. So, I used to own a coaching company that I no longer do this, but I had a coaching company, and we would go and I consulted offices all across the United States. And what we did is we decided, Charles and I, my business partner, we decided that we would go ahead and we would put unique phone numbers and track all the marketing for all of my offices across the country. Because oftentimes when we would say, how's your marketing doing? They would say, it's not doing that good, or it's doing okay, but they don't know what the return on investment is. They don't know what's happening. So we put unique numbers on everything.
Right.
And so what we did is we seen what worked, whether it was magazines or billboards or the radio or TV, Facebook, or Google Ads, or whatever it is. We tracked it. And what we did was we were trying to find a common denominator, what worked consistently across the entire country. What we found was that it was Facebook ads and Google ads. That was consistent, that there was consistent ROI. Those are by far the best two types of marketing that exist in dentistry.
Right.
Now, what we did was before we were not, we weren't doing the marketing. we were just tracking the marketing.
Right.
And then about 2 years ago, we're like, all right, well, we're going to go ahead and do this. We're going to start doing Facebook ads, and we're going to start doing Google ads. Now, it's really important to understand that there's two very different types of, those are different types of marketing. One is blanket marketing. One is target marketing. One costs a lot of money. One doesn't cost that much money. Mm-hmm. Blanket marketing, you're pretty much throwing a blanket out to a massive number of people and hoping that someone is interested in your services, essentially.
Yep.
Target marketing is going and finding people that are already looking for your specific service. Examples, dental implants.
Right.
And so basically what we've done is we've created, a laser-focused marketing service just on dental implants. So we said, all right, well, you know what? Since Facebook works great, but since Google works great as well, we want to niche down. If you want to niche down, then you need to get into Google ads. So we said, all right, well, we're going to ditch the Facebook ads. We'll promote the Facebook ads for people who don't have as much money.
Right.
For the marketers that do Facebook ads. And like I said, it's great. Facebook is great. However, the return on investment is significantly higher with Google ads from what we've seen. Now, there's absolutely great return on investment from Facebook ads. However, for Google ads, it's a lot higher from what we've seen.
Right.
And so we said, all right, well, we're gonna do just Google ads, and we're gonna get really good at it. And what we found out is all right, well, we weren't done growing. We weren't done changing or evolving the company. We're going to track everything like we have always done, and we're gonna see what works the best. So is it sleep apnea? Is it ortho with Invisalign? Is it emergencies? Is it dental implants? And sure enough, dental implants by far brought the highest return on investment, hands down, no questions. It's not hard to get a return on investment because these cases are a minimum of like $5,000. And what patient comes in with just a single implant that needs done? Not many.
Right. Yep.
So we said, this is about a year and a half ago, we're going to go and we are going to become the best at dental implant marketing, specifically through Google AdWords. And that brings us to today on a wait list. Yeah. And we're changing lives. It's not like we're just doing the marketing. We're changing lives. Right. And we're changing lives not only of dentists, but their teams and their patients. So let's talk about the trickle effect.
Yeah, absolutely.
So what happens is we provide opportunities for dentists to change patients' lives. And when I say change their lives, I mean give them a smile that they have always wanted. They've saved up their entire life. A lot of times this is their retirement gift. Oftentimes they ran into some money and now they want to fix their teeth. It's all people that have a way of getting this money. You just have to make a financial option.
Because they were searching for it. I mean, that's really kind of, that's why it works. Because they were searching, they were typing it out.
They typed into Google dental implant Tennessee or whatever, dental implants Nashville. Mm-hmm. And then our ads pop up and our ads are very high converting. And it just, that's just how it is. But so basically what happens as far as the trickle effect is we provide dentists with the opportunity to change an individual's lives. These are opportunities to make someone have an amazing emotional connection with you because you literally have changed their life because they can smile.
Right.
I mean, it's life-changing.
Sure.
And so what happens then is not only did that dentist change that person's life, they also closed a massive case. If you're doing full mouth reconstruction, you're talking, $20,000 at minimum.
Right.
So you're getting a $30,000 case, and most dentists that are getting these cases, they're able to share not only that emotional connection with the team, but they're able to do things with the team now as well that they couldn't do before.
Yep.
Why? Because you're getting injected with cash in your pocket on a regular basis because of the marketing that we put on.
Right.
So we've changed all these different lives, and I feel like it's okay to be vulnerable. We retained, prior to January, we retained 80% of our clients. and we didn't retain the other 20%.
Right.
And what would happen is the client would say, or the dentist would say, it's not really working out. It's not the right leads, or patients are canceling, or we're not able to close these cases, or something like that. And we were very guilty of pointing our finger. We would be like, well, it's tracked, and there's recorded calls, and these are interested patients. There's actually, you got 35 in this month, and you got 40 last month leads. It's not us, it's you. It's your team. Your house is not in order. Something's broken.
Sure.
But we pointed the finger, and we didn't provide a solution. So now we're no longer pointing the finger. We're taking it upon ourselves
to educate them on the why
to educate them, but to support them.
Yeah.
So now we have a client success manager. The client success manager, and that's Michelle. She actually makes sure that the dentist and the team is trained and ready when these leads come in, and that they're doing good and sets the right expectation, et cetera. Then what we've decided was we have about 30 people in dentistry that are the experts as it relates to dental implants and high value cases.
Right.
So what we're going to do is we're going to go and we're going to essentially create a university. Mm-hmm. And that university, what will happen is we will go and we'll do webinars 1 to 2 per month, and we will say for Laura Hatch, for example. Mm-hmm. Laura Hatch is the best at front office stuff. Right. She owns Front Office Rocks. So what are we going to do? We say, Laura Hatch, let's do a webinar and let's record it. And we want you to tell us how people should be answering the phones. And when you tell us how they're answering, or when you teach them how to answer the phones, you'll be providing massive value in an hour training. And guess what? For Laura, it's great because she gets to be in front of all of these dentists, but she's given them massive value.
Right.
And oh, by the way, Laura's program's only $150 a month.
Very inexpensive.
That's $5 a day.
Yeah.
Hello?
Yeah.
So if you like Laura, then you can go sign up for her stuff if you want, kind of thing.
Sure.
But what we're doing is some of these consultants aren't that affordable. Right. $2,000 to $6,000 a month for their consulting services. So what we're doing is we're going out and we're saying, give us 30% of what you got. Give us the best 30% you can give us in an hour time, and train us on a very specific area in the entire process, from the time they pick up the phone till the time they close the case and accept the money. And so we're now, if they have an issue with answering the phone, if they have an issue with presenting the case, if they have an issue with treatment planning, if they have a clinical issue, we now will say, you know what? You guys need to go ahead and go to the university and watch this course on this specific pain point.
Step in the process.
So now it's like we're not just a marketing company. We're supporting them as well to close the leads.
Yeah. Because what did you find, I think I'd heard you say before, for those 20%, when you open those floodgates and all of a sudden they get all those patients, I think I'd heard you say that it kind of exposed their practice in a way that they were like, holy cow, how do we manage all this? Yeah. And it sounds like that's kind of the gaps that you're filling in from a support perspective.
Yes, absolutely. And then here's another big picture thing, right? So they're used to seeing their regular patients, come in and they build a relationship, and a lot of times their teeth aren't messed up, right? When you're marketing for dental implants and smile designs and full mouth rehab, here's the thing. You want a patient to come through your door. You want this, beautiful woman that's, got this long hair and Louis Vuitton purse and the beautiful smile with a lot of cash. That's what you want. That's what you're thinking. There's just somebody that's going to drop this lump sum, and they're just going to be, not looking bad as a person.
Right.
No. You're marketing to somebody who doesn't have teeth.
Right.
Right. You're marketing to somebody that has a serious issue, a serious condition in their mouth, and then when they come to you, they might not be presentable.
Sure.
They're not going to look like that man in a bow tie and suit that's looking, like that's looking like he can spend a little money. You know what I mean? They're going to be coming in looking like somebody who doesn't have money.
Sure.
And let me tell you, let me also be even more honest. 70% of patients that come in don't have the money. They can't afford it.
Right.
But are you going to not do the marketing and miss out on those 30% of patients that can?
Sure.
I mean, you think about it.
Yeah.
One case can pay for a year's worth of marketing.
Right. Right.
You know what I mean?
Right. Not to mention, I mean, a lot of those other patients that come in, maybe they can't afford it when they first come in, but they're impressed by what they see in the practice, and then they may find a way down the road to get it.
And that leads us into financial options.
Yes.
So next week, I believe, we have a meeting with Dr. Bruce Baird. And Dr. Bruce Baird is, he focuses on treatment or not treatment, but financial options. So now all of a sudden you have all of these financial options that allow the patient to essentially say yes to treatment, and you create an income stream for your office.
Sure.
So if you have financial options, it's a lot easier to get the patient to say yes to treatment because they want it. They were the one that was searching for it online in the first place. You just have to make it affordable for them. And no, you don't have to lower your prices. You keep your prices.
Sure.
So.
Yeah. It's exciting stuff.
Yeah, it is.
It's wait list stuff.
It's wait list stuff.
It's like people standing in line waiting for their iPhone.
Yeah, hashtag wait list. I mean, you know what I mean?
Yeah, yeah.
And we're running a special for the show.
Let's hear about it.
So essentially, if you sign up by June the 1st, we're actually going to send you as a dentist. We're going to pay for your flight, and we're going to pay for an all-inclusive cruise on Smiles at Sea. And then we're going to give you VIP registration too, and that's a bundle, right? And then the cruise happens to be for 2 people. Okay. Now, if they want to bring their entire team as well, we're going to comp the entire event ticket for their entire team, and I'm going to tell you why. We believe in community, so we are trying to create a community of dentists and dental team members that place dental implants and do high-value dentistry. And so we want them all on the boat. And we want to essentially create this community of support. Mm-hmm. And what's happening is we're trying to get the team involved, because without the team, it's nothing.
Yep.
So we're trying to get the team involved, and which is, it can be fun if you make it like that. So we're gamifying what we're doing as well.
Right.
So each month what happens, we're rolling this out in June. Each month what happens is you will, as a dentist, you will go on a video shot from an iPhone or a Droid, and you'll say, "Hi, my name is Dr. Phil from Atlanta, Georgia, and this month our biggest case that we closed was $47,000, and we had a total of 7 cases this month." Well, what happens is all of our dentists that are involved in this, they essentially have, they submit their video, and we put the video together in like a trailer, a compilation, and the dentist office with the most cases and the dentist with the biggest case gets a cash reward or a major prize every month for their team. Not for them.
For their team.
For their team.
Yeah.
And now all of a sudden we're getting the teams involved because they want to win this $1,000 prize or whatever it is.
Yeah.
And we're getting everybody involved to compete against one another because they want to be the office that has the most cases that month.
Yep.
So we're kind of, we're doing it's a spin on regular marketing.
Yep.
It's fully emerging in the practice and being involved.
Well, I think what I like about it, Elijah, is the fact that with a lot of these new techniques of marketing and people learning more with what you guys are doing with like Google Ads, it's changing the amount of patients that practices were normally used to getting.
Yes.
And so even though I think that people always wanted to have a lot of patients, were they prepared to handle it?
Right.
And so it sounds like,
Well, I think I want to make it very clear that we're not going to get a whole lot of patients.
Right.
We're going to bring you a whole lot of leads, and then you convert those leads
into patients.
Into, we'll just say 5 or 6, maybe 7 really good patients. So you have to screen through them. But here's the thing. If you are closing even 2 or 3 of those patients a month,
it's worth it.
It's worth, 50 new patients. Think about that. Yeah. If you can close a case that's $40,000, even once a month,
sure,
what is that worth?
Yeah.
40 new patients. Their insurance plans are $1,000. Maybe $1,500.
Right. Yeah.
It's called working smart,
exactly.
not hard.
Exactly.
So, and a lot of our practices, they have oral surgeons or periodontists that go to their practice, once or twice per month. So if the dentist is not placing implants, that's okay. We just encourage you to keep the money in and stop referring it out.
Sure. Absolutely.
And then for the dentists that want to place implants, we actually have a dental implant cruise in November with Dr. Arun Garg. Dr. Garg has taught the most dentists in the world how to place implants. Over 10,000 in total have been with him for an entire year of training, not to mention all of the other dentists that are less than a year, but that's a large number.
And that cruise is going to
Cuba.
Yeah.
To Cuba, November the 15th through the 19th. And it's implant seminars cruise, a hands-on workshop.
Yep.
A dentist will be able to place simple implants and do socket preservation by the time that they leave that course.
Okay.
So it's going to be amazing. I'm excited for it.
Awesome. So how can people learn more about the company and what you're doing and things like that?
Yep, absolutely. They need to go to www.drivendentalmarketing.com and schedule a free 15-minute strategy session. So just drivendentalmarketing.com, schedule a strategy session, and we'd love to ask any questions. And here's another really cool thing. We don't take on everybody. So you have to be a good fit for us as well. That's so important to understand because all we have is our reputation. And if we just took on everybody, then we wouldn't have a good reputation.
Sure.
So because those people wouldn't be fully committed, it might not be a good fit. So we need to test out and make sure that that's a good client for us as well. Mm-hmm. And we're still on a wait list.
So one last takeaway, and you may have mentioned a little bit, but with what you've learned here, even just in the last 4 to 5 months with a lot of these practices taking it on, and I've seen great feedback on just the results you're getting in the practice.
Yes.
Maybe one takeaway that you could share to those 20%, those that for whatever it's worth, we're still trying to figure their own way of how to handle the leads or what have you. Maybe just one thing that you've learned that you could share with everybody.
One thing that I've learned is that I would say from the 20%, as a company, I've learned that we need to support them more.
Right.
And for offices, I would say the biggest thing is that they also need to know that even though they might think that that Miss Susie who answers the phone and says, dental office, they need to be coachable.
Right.
So if you don't have a coachable team, then we probably are not the right company for you. But if you have a coachable team, then absolutely we're going to provide you with the best support ever and coach Miss Susie who answers the phone. Dental office, this is Susie. Dental office.
There's a lot of Susies out there. I mean, right. if you are Susie that's doing a great job, keep it up,
Yeah, but let us coach you on answering the phone and getting the patients to come in and building that value and that relationship before they get in so they show up for your appointment, or teach you the value of taking a $50 deposit just to hold the appointment.
Sure.
And that deposit is refundable if they show up for their appointment and they don't want treatment,
right.
or they put it towards treatment.
Yeah.
It's small things. It
Absolutely.
has to be coachable. That's the takeaway for them.
Well, and I think what a lot of people are realizing, it's interesting having this conversation with you, is that marketing, for whatever reason, the expectations on what people think they're going to get for their marketing is all over the board, right? Yep. A lot of people think that if they come to a marketing company, like you said, that you're not only going to help with the leads, but then you're also going to help those people convert. And I think it's very important that you bring that up, because that's not the job of the marketing company.
It's not. It's to provide the leads.
Right.
It's not the job.
Crucial.
But you know what? We don't want to have a leaky back end.
Sure.
We want to keep everybody.
Yeah.
So that was the solution.
Excellent. Well, thanks a lot, Elijah.
Absolutely.
Always a pleasure having you on.
Yes.
And everybody, please check out Driven Dental Marketing, learn more about it, and get on the wait list.
All right, get on the wait list. Thanks.
Thanks, Elijah.
All right, buddy.